does involve.
Okay, you're good.
Okay.
Gloves. Everything looks
Aubrey?
fine. No cuts.
Can I get your last name and date of birth?
Hair looks healthy. Scalp is healthy. I'm gonna check
Perfect. My name is Regan. I'll be your nurse today, and I'll just be performing a quick head-to-toe assessment, okay? It shouldn't take more than 10 minutes. Does that sound okay? All right. And can you tell me what time of the year it is? What season it is?
Normal.
Perfect. And what's the closest holiday we got coming
Skin
up?
looks healthy.
Halloween.
Cuts.
Perfect. Thank you very much.
Some
Okay. So the first thing I'm just gonna start with is I'm gonna sanitize my hands before touching the patient, and then I'm going to make sure that the room is safe for both me and the patient. The bed's at the lowest level right now, and the railings are down because she's sitting. She's got her collate there. Otherwise, I think the room is good. Okay. Now, I'm going to start your assessment. I'm going to need to touch you a couple times during this assessment. Is that okay? I'll make sure, like, you're all right and doing okay. And if you have any questions, you can stop me at any moment. And if you need me to explain anything, you just let me know, okay? Okay, so I'm going to first start.
And I'm realizing now I forgot to ask the patient who's experiencing.
So what's your reason for coming in today?
And then I would have asked further questions there. Are you having any
Are you
pain?
just coming in for a visit?
Perfect.
Okay, so you're not having any pain, or there's nothing you want me to be aware of?
Alright.
Okay, perfect. Well, I'm just gonna take some quick vitals, okay? So this is where I take her temperature, and I take her pulse and her blood pressure, and then I check her respirations, just get all her vital signs, and then I document them and rewash my hands.
Good. No swelling.
And then I'm going to move on to the head-to-toe assessment. So, since you are not having any pain, I'm going to not ask any of the pain questions. And so, we're going to start with the head and the neck area. Have you noticed any changes in your, or had any pain or discomfort in your eyes recently? No? Okay. Have you had any sinus pressure, nasal congestion, like a stuffy nose or nasal drainage recently?
Shouldn't be too cold.
No?
Normally I
Okay.
would have the patient.
Have you had any ear pain or hearing problems that you want me to be aware of?
Some areas and just have you take
Okay, and then how about any headaches, dizziness, loss of memory? Have you lost consciousness recently? Nothing? All good? Okay. And then how about your mouth? Have you had any mouth pain, dry mouth, like throat has been hurting, like anything going on there? All right. So I'm just gonna also note her appearance in this one. Like,
how's school going? Nothing
she
too
looks her
tricky?
age. She's fully alert and her consciousness is full.
Your lungs are very healthy.
Also, like, she looks like she's got good hygiene, like she's wearing appropriate clothes for the weather. She brought a sweatshirt. It's a little chilly out, so
One last spot. Sorry
overall
about
I'd say she looks okay. Her skin's a good color. I'm not seeing anything obvious and out of the ordinary.
Heart sounds.
So now I'm gonna just look in your hair. I don't see any bugs or anything. It looks good. And then, is it okay if I look behind your ears and around your ears? Okay. Okay. Those look good. I don't have the light to look into them. Okay. And then I'm just gonna have you open your mouth for me. Okay. And can you stick out your tongue and then lift it up for me? Perfect. The oral mucosa looks good. And I'm just gonna check your eyes now. Okay. So I'm gonna have you follow my finger, okay? Perfect. And her sclera looks very white, looks very healthy, and her eyes, there was no problem there with that. So now I'm just gonna cover one eye, okay? And I'm gonna flash a light. I want you to look just directly at my nose and try not to blink, okay? Okay, and both her pupils are equally round and reactive to the light and accommodation. They both dilated and look good. Okay. So check the mouth, check the ears. Now I'm just gonna check your neck. Okay. So is it okay if I feel your trachea? Okay. And then I'm just gonna feel your lymph nodes as well.
Sorry.
And that all feels good. I don't feel any anything
Good.
abnormal
Equal
there.
sides. I forgot to check this cat refill earlier, so I will do that now. Could I have you swing your,
This. I'm just gonna wash my
your legs
hands
back?
one more time.
Perfect.
And document my findings on that one. And then,
Perfect. Under 3
now that
seconds.
we are done with the
Alright,
head and
last
neck,
part of the
I'm
exam, I'm
going
just
to
gonna check
move
some muscular stuff.
on
So then you put your
to
arms out like this.
your
Perfect.
chest
So,
cavity
hold your
and like your
Good.
heart.
Push.
Okay, so have you had any racing heart, or have you had any
And then-
swelling in your legs or arms? Have you
And do the same
felt
thing
your
with your
pulse
legs.
beat irregular,
Towards yourself.
or have you had any chest pain?
Perfect.
No? Okay.
In.
And then normally I would, if
Towards
this
yourself.
was a real hospital,
Good.
I would
And then
just have her remove the area, just so
Very
I could
sorry
look
about
and make
that.
sure that there's
And then
no
finally, I'll be checking the
rashes,
skin on his
lumps,
legs, make sure
or
there's no
bumps,
edema
or
or
lacerations,
anything.
or swelling or
Sorry, that'll be
bruising,
my
just
roll of
anything
light.
out of the ordinary.
Your
But I'm not gonna have her
pant,
remove her clothing.
sleeves, pants.
So then after that, I'm just going to listen to her heart.
Every your pant leg,
Okay,
yes.
and
Everything looks normal.
I'll try to warm this up for you.
Very in shape individual.
So
And the
I'm just
doctor
gonna
will show
start,
you
is
everything
it
straight.
okay if I put this on your
And
chest?
smooth.
Okay.
That
I'm
under
just
10
gonna listen
minutes?
to your heart.
I miss anything? I feel like I missed something. In document.
Yeah.
We have to.
Okay, nothing abnormal there. It sounds very strong and very healthy. I'm
Yes.
not hearing anything out of the ordinary, and it's beating very regular. Yeah, it sounds very good. Okay, and then next I'm gonna move on to your lungs. Okay, so have you had any shortness of breath or anything like that recently? And you said no to chest pain, but you haven't noticed any changing in your breathing or breathing patterns? Okay, so again, I would check, make sure that there is nothing
Do you want to record
wrong with her chest, like visually. I palpate, make sure I don't feel anything unusual. And then now I'm gonna listen to your lung sounds, okay? So it's just gonna be, I'm just gonna have you take a few deep breaths in for me. And if you start getting dizzy at any point, please let me know, okay? So just gonna go under the clavicle here, so if you can take a deep breath for me. And
Also, we can talk to
Perfect.
Sky,
One more
and I
time.
guarantee you she will let us in the room tomorrow. In the ambulatory.
one more time.
No. Well, absolutely. I was also going to say, but for him recording, it is way less stressful
Okay,
for
and
you.
then I'm gonna go down here,
Because then it's
okay?
also like, so you're on the
You're on the
tables.
exam table.
So then it's you don't have to like maneuver around
And
the
one more
bed.
time.
No, it's built for.
It's built for a.
Perfect. And then I'm just gonna go to your back here. Okay, is it okay if I move your hair?
I'll be fine.
You're right.
Okay, so I'm just gonna listen to your breath. Can
Dude,
you
this
just
is
breathe
a-
in for me?
This is like a warm.
Yeah, I gotta get the TV anyway.
Breathe in, breathe out. Okay, breathe in, breathe out. And one more time.
What? Yeah.
Are you examining?
Yes.
You doing all right? Dizzy at all?
Oh, you're recording?
No? Okay, good. So,
I'll go grab my.
that all sounds good? Your depth is,
Oh, otherwise.
Sorry.
Yeah, because it's just.
your depth is good,
I'm
your
just
breathing
chilling.
rate is
I felt like
regular.
that took like 15 minutes.
It
When
all
I got to,
sounds,
like, the arms and
it all
legs, I
sounds
was like,
good,
this
normal
is
and healthy, okay?
Yeah,
I didn't notice any crackling, wheezing, popcorn noises, so that's a really good sign. So next, I'm just going to look at your abdomen, okay? So I'm just gonna, so if you wanna lay down, you can too, but I'm just gonna feel your abdomen, make sure I don't notice anything like unusual, make sure it's symmetrical, make sure there's no distension, okay? So if you just wanna lay down for me, that'd be great. Just because it's easier for both of us. Is that comfortable for you? Put your legs on the bed. Okay, so I'm just gonna feel around. Is that okay?
Mm-hmm.
Okay, so you tell me if anything feels painful or.
It's just we gotta deal with rejection sometimes.
I'm not feeling anything abnormal, so that's a good sign. And normally I'd lift her shirt up, after your permission, of course, and check to make sure that there's no bruising, make sure it's symmetrical and there's no distension, and just that there's no lacerations or anything out of the ordinary. Okay, and now I'm just gonna listen to your bowel sounds, okay? There's four spots I'm gonna listen to. And remember, if you have any questions, just let me know. And I'm gonna listen here, 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 and here, and it should be relatively quickly, okay?
I'm excited to start an IV one day. No cheating occurring.
Okay, it all sounds good. I'm hearing lots of gurgling in there, so that's a good sign. Okay.
Come in.
So,
How are you doing today?
if you'd like to sit back up, I'm done looking at your stomach, but if you're comfortable, you can keep laying there. Next, I'm just gonna ask you, I'm not gonna look or anything. Have you had any changes in any of your bathroom habits, like your bowel movement, or like have you had any painful urination, changes in the color of your pee, or is there like a weird odor, anything unusual in there? Okay, and is there anything else you want to let me know about so I can document just anything else unusual?
Yes.
Okay,
I do.
perfect.
Do you know where you want to go?
And then next, I'm going to move on to your extremities. So I can see here that, well, I'll start with your upper extremities first, okay? So I'm not noticing anything unusual. Looks a good color. There's no bruising, swelling, or anything unusual. So first, I'm just gonna look at your nails. And have you noticed anything like different about your skin or nails recently? No. Okay, and how about your muscles? Have they felt weak or stiff lately? Have you had any joint pain? Okay, so your nails look good and healthy. I'm just gonna check your pulse here. Okay, feels strong, I can feel it, it's very regular. Okay, and then could you just lift your arms up for me like this? Perfect, and then put them down, bend your elbows for me, move your wrist kind of, just no pain there. Okay, so looks good down up there, so now I'm just going to check your legs, okay? So, noticing no bruising, no lacerations, nothing out of the ordinary, the skin looks intact and good. I'm just gonna have you take off one of your shoes if you could. You can take off both, and then I'll just need you to take off your sock. I'm just gonna look at your nails and make sure they look good, and check your pulses down there. So I'm just gonna feel down here for a pulse.
Seeing any issues? Oh, sorry. It all looks good.
Okay, I feel that one there. That one feels just strong, like the wrist. It's very regular. And I'm gonna feel and try to find this one.
All good. All right. So now I'm gonna take this light out, shine it in a couple places. Gonna check inside your ears, your nose, and your mouth, and then check your eyes as well. Make
Okay.
sure your pupils are
Yeah, and I feel that pulse there. So there's nothing unusual there. That's
good. And obviously, I
beating very regularly. So you can just put your shoes and socks back on if you want. And then her nails look good, nothing unusual on her toes there, which is normally a good sign of a person's health if their toes look good. And just before we go, I'm just gonna make sure, now that I'm pretty much done with the assessment, I'm gonna make sure her bed's at the lowest level, her bed rails are up if she's gonna be laying down, and she has a call light if she needs. And then I'm just gonna check one more time, make sure she looks okay, there's no facial drooping on either side, her face is symmetrical, and otherwise, yeah, I will let the doctor know that you are all ready, okay? Thank you.
Okay, perfect. And then stick it out and say